Hello, dear viewers. Welcome back to D-Life in channel. I am your host today, Prasanna, proudly a D-Life.in life member and a low carb nutritionist. A quick note to our audience. This is not a medical or nutritional advice. Kindly consult your doctors and low carb nutritionists for any changes. So whatever is going to be discussed in this session is for informational purposes. D-Life is more than a platform, it is a community. We stand for those facing diabetes, obesity, PCOS, and other metabolic challenges. With over 250 success stories, 1,200 recipes for healthy low carb dishes. We are here to make a difference for the better through eating right. Our visionary, Anup Singh, an IIT Roorkee engineer, founder of D-Life. And Anup and D-Life have been honored as icons of India by Outlook magazine for pioneering low carb in the nation. Join us on this enlightening journey towards better health. I would like to introduce today's guest, Meenakshi Rana. Hi, Meenakshi, welcome.
Thank you. Thank you so much.
I would like to give a brief introduction about Meenakshi. Meenakshi Rana is Certified Low Carb Nutritionist, Certified Yoga Instructor from Ministry of Ayush, Weightloss Coach, co-founder of Fit Family, Hit Family community, which is on a mission to make 1 million families obesity-free and metabolically healthy. And last year, transformed 500 plus people who achieved their ideal body weight, reversed fatty liver, thyroid problems, PCOD, digestion issues, and back pain. She is passionate about her soon-to-be born program, through which she is helping women to be more fertile and baby-ready so that either they conceive naturally or get best outcome from assisted fertility techniques. She herself fought an infertility battle for 17 years and conceived after 5 failed IVF attempts in the age of 40. So now she wants to help other women. You can see all testimonies of Fit Family, Hit Family Insta and FB page and her own personal Insta handle, Fit and Hit Mom. The websites are fitandhitmom.com, fitfamilyhitfamily.com, and there is a YouTube channel in the same name as well. So once again, welcome Meenakshi. And I would like to start with the question. I would like to know what is it that made you get into the health space, and a brief background and your story.
Yeah, thank you. Thank you, Prasanna. First of all, I'm so thankful to you for such a warm welcome. And I thank D-Life community and their founders, Mr. Anu, for inviting me here, for sharing this so that I can share my story and reach to more people. I'm so delighted to have him. So friends, my journey in health space started 20 years ago. Actually, when we got married and we did not conceive for 1.5 years, my family, start pressurizing me that why it is not happening, then you should go for all checkups. Then I went for a checkup, and there I found that I have anemia problem, low hemoglobin. And so we thought that might be the reason for my, not getting result, not becoming pregnant. So we started treating that. We are from Jat family. So in our culture, a lot of ghee, milk, and curd, and all desi stuff. My mother-in-law used to prepare that juice of beetroot and carrot, and I used to drink that. But after 3 months, I got my my blood test again, and there was not much difference. Then one of my friend, she was my husband's friend. She was, into health and nutrition already. So she suggested that if your hemoglobin is low, then you should, add protein also, because hemoglobin is not only lack of, iron, it is protein also. So I followed her advice and started, enriching my diet with sprouts and everything. So she gave me some, some extra supplement also, because as we were vegetarians, so she gave me protein supplement. So I started taking that, and it was very tough for me to take all that stuff, because we have never used, we were not fond of all these artificial things. But somehow I wanted to get result in my, I want to start my family. So I thought, let me try this. So I started taking that, and after 3 to 4 months, I got my again blood test done, and then I found significant improvement. And then from there it started. I got curious that how come my mother-in-law was trying so hard, I was trying so hard, eating from natural things, but I did not get that kind of result. So then I got curious, and I studied about nutrition and all the things. So I think I answered your question, that my journey into that health space started 20 years ago.
Okay.
Then, there were a few problems in my family also. Somebody was having chest congestion, somebody was having joints pain. So I did one nutrition course, and I started applying that knowledge on my relatives, on my near and dear ones, and that some remedies, home remedies, and they started getting results. And so I thought that, yeah, so many people are suffering outside. So let me start giving advice after taking some professional course. Only then I can start. So I took some courses, and then I started giving advice, and we founded a community, but there was no name as such. But after, COVID, there was a lot of transition, because we were all stuck in our house, and though we were approaching people before COVID, going to their houses and meeting people here and there, that was restricted. So
Okay.
we then came, we took help of social media, and then we formally formed a community, Fit Family, Hit Family. And we started on weight loss, because weight loss is more visible, which you
Correct.
can, showcase. You cannot showcase that my joint pain is improved, okay, unless and until you show the reports. But weight loss is visible. So we started that major in weight loss segment, and there people start getting great results. And last year I founded this, I typed on Google low carb nutrition course, and there I found this awesome community, D-Life, and I got my diploma done. And
Okay.
amazing platform is this, and I'm really enjoying being associated with so many people over here who are knowledgeable and who are change makers, okay,
Okay.
who are truly making an impact in others' lives. And after COVID, we all have realized that health is so much precious. No amount of money can get you back your health, which is gone due to your bad lifestyle, your poor nutrition habits. So this is my story into health space. But as I struggled for 17 years in infertility, because that was unexplainable infertility. There was no reason behind that. My all reports were good. My husband reports were good, but we were not getting results. So I was not tensed. I thought there is some procedure, IVF. I will go and I'll get it done, and my problem will be solved. I was so, confident about that. Little did I know that its success rate is not more than 50%. So when I got my first IVF done, I was very happy that now my dream of having baby is, will be fulfilled. But when my report came and it was negative, and that was a big shock for me. Because I was working in corporate, I am otherwise I'm master's in computer science. So I was having full-time job, and I was traveling here and there and taking hormone injections with me in that, ice pack in the on those because we have to keep them in cold space. So during travel, I used to take ice packs and I used to keep them, and I used to inject myself. I learned how to inject myself, and so there was lot of stress. Then my result came negative. Then we again switched to doctors, and then doctors, and then doctors, and this whole process took 17 years. And I was so you can say shattered emotionally and physically, and there was so much pressure. Now I can make one diary where there will be the list of all the babas who treat you, who give you some jari booty for infertility. Throughout India, I have traveled all the temples, all shrines, okay, all gurdwaras, so that my prayers are answered. But God has its own time and reason for do things for all of us. And I think God gave me this problem because he wanted me to serve other people, other mothers or other couples. So my husband was with me. I think that was the biggest reason I could continue for so many years, trying and trying persistently. And the thing which helped me in this journey was, of course, diet. At that time, I was not aware that I'm taking low carb diet, but somehow I changed it with my own research. I increased my protein intake. I increased my vitamin B level, and I started doing yoga for my stress. Okay, and I was as I told you that we are vegetarian, so egg were not in our
Yeah.
list. Yeah, eggs were
Okay.
not in
It was not the staple food, usual
Yeah.
staple food. Understood.
Yeah, even just 3-4 months back only, I started taking eggs. So I was only completely on, lacto-vegetarian, you can say.
Okay.
So I need to take help of outside supplement for protein to complete my intake. And earlier there was no, because when I conceived 9 years back, there was any gynecologist will never suggest you go for vitamin D checkup, go for vitamin B checkup. They will not suggest you. They will just suggest you follicular study, okay, in your second day of cycle, and then they will monitor it. Then they will inject you with hormone injections and sperm analysis. Only these were the tests. No one suggests. Till now, many clients are coming to me for infertility. I ask them to check their, blood parameters, and I suggest them to get your insulin done, get your insulin fasting, and your fatty liver test, your liver profile test, and estrogen test also. So earlier these were not suggested. Even till now, it's not suggested. So somehow my stress level was very high because of so many failures. So I my all that yoga thing helped me, meditation helped me in bringing down my stress, and we got the result by God grace. Yeah.
Okay. It's really truly inspiring listening to the overall growth which you have went through and the ordeals which you faced through. It's really inspiring. So now coming to the context of something called a Pareto's principle, where 80% of the results are gotten by 20% of the concentrating on 20% of the parameters produces 80% of the results. So in the context of our discussion today, infertility and fertility, if you would put it succinctly, how much role does a food, and that too a low carb nutrition, I would like to hear your thoughts on that. How much does it weigh in, and what is the biggest parameter which moves the needle in a big way? What was it in your experience, and what is it that you think?
Yeah, very good question, Prasanna. Uh, when we are now taking up cases for weight loss as well as for fertility, one thing when I notice and when I ask person that what is your eating, schedule and what do you eat in whole day, they tell their carb intake is so much. From morning till night, they are eating mostly carbs. So diet plays 80% role in achieving the results. Okay, we explain them that your eating carbohydrate is not a fertility diet. I give them example of an egg. When you see an egg, what do you see in that? There is a fat in form of yolk, and there is outside covering in form of protein.
Mhm.
So if a life is existing in form of these two ingredients only, these two macronutrients only, then how can you expect yourself to be fertile without these two? So I encourage them to include good fat in their diet. I encourage them, I give them suggestions that if you are vegetarian or non-vegetarian, then you can use plant-based or you can use animal-based. If you are non-vegetarian, then you can definitely go for good quality protein. Okay, and that changes everything. When the frequency of carbohydrates is decreased and when the amount of carbohydrate is decreased, that reduces the inflammation in them, that reduces the that liver which is not giving good grades of liver in their test. If it is not shown, then that comes into the range and they start getting some results. Either they reduce something, there's some weight, or either they start feeling better in form of energy. Okay, their inflammation is gone. So
the majority of the food is going to be protein rich and as much less carbs as possible. Is that what? Am I understanding it correctly?
yeah, protein and good fat.
Good fat. Okay.
Yeah.
Okay. So I would invite you to, if it is possible for you to provide a case study or a particular case which you have gone through, it would be really helpful for the listeners to relate to it and then understand and derive value from it. So would it be fine with you?
Yeah, sure. Actually, there are many cases, but one case is very, that is you can say, very, very close to my heart because this lady, Archana, she belongs to MP, and her sister reduced 18 kg through our community. And this lady, she was struggling with weight issue as well as PCOD, as well as thyroid and infertility.
May I know the age? Sorry to interrupt you. The age of the person?
Yeah, I'm just coming to that point.
I'm sorry.
She is 35 years old. Okay, and she is non-vegetarian. And when she approached us, and she told that her doctor suggested that either you reduce your weight or you should go for IUI or IVF. And she was pre-diabetic also. So when I asked her about the diet, and I suggested that you go for few tests, and she underwent, and I found out. I just wanted to share. Just a minute. I just wanted to share. Just a minute, I'm sharing.
Yeah, sure.
Uh, yeah, can you see it?
Not yet. I believe it's not showing up right now immediately.
Thank you for your patience.
No problem.
So this is the blood marker.
Okay.
Yeah, this is the form which we normally make for our soon-to-be mom program. And this lady, Archana, and her estradiol on 21st day of her cycle was 270, and her progesterone was 3, and pelvic ultrasound ovarian cyst, and this thyroid again, TSH is higher on the higher side, and her triglycerides were 225, and her CRP inflammation, that is 6.3, and then HbA1c again, it's on the higher side, glucose, and then insulin fasting. Just see, it is 26. Okay, and just a minute, and after 3 months, I didn't get these tests done again, and I got these tests: triglycerides, CRP, HbA1c, and you can see these are
Yes.
the changes after 3 months of low carb diet and nutrition and stress management and some, we suggest them to clean up their environment also.
Okay.
So to reduce the toxic load of all hormones disruptors. So after that, these are the results. I just share the original reports also with you.
Okay.
It is here, and both. Can you see?
Yes. Yes. Able to see. Correct.
Yeah, she was suggested polycystic ovary, and she's having thyroid issue. TSH is on the higher side.
Okay.
Yeah.
So, this was previously, and then once she adopted the low carb.
Yeah. I could test only those parameters which I showed you.
Okay.
These tests we could not done because she conceived. After 3 months, she conceived.
Okay.
And in month of Feb, she delivered in the last week of Feb.
Wow.
Yeah.
That's really really a great achievement, I would say. So
Yeah.
cleaning up the food and then adopting a low carb lifestyle, the results are there. So
Yeah, even
thanks for
our Fit Family, Hit Family YouTube channel, there is a live interview with her also. So if any of you is interested, you can go and watch that.
Okay, thank you. And there is one question. See, the overall trend where people and where I have seen in my colleagues as well, and the people with whom I'm interacting, people tend to go beyond 35 or 40, particularly women also, uh, for childbearing. And I'm not sure how it was previously, 50 years ago, 60 years ago, but in India, it was lesser age, people were conceiving. And right now, that the overall trend is to postpone pregnancies. So, what is your overall take about that? And if there is no other option, because no one can go back in time, for people who are struggling to conceive after 40, or not struggling as such, but for a 40-year-old woman, what will be your professional advice based on your experience and based on your qualifications?
Yeah, thank you. Very good question, Prasanna. Um, Actually, yeah, the trend is going on that people don't want to conceive or have this, they don't want to start their family. They want to establish themselves. They want to enjoy life. And later on, they think that it will happen to them. But as far as fertility score is concerned, it really start, declining up, and even after 40, it declined a lot because in women case, we are given a particular number of, eggs in our ovaries, and though they are in millions, but when due to our lifestyle, the quality of egg also reduce and the number of eggs also reduce. There is a reserve in our ovaries that also reduces. And the eggs, those fertilize, there is some change in the DNA due to age factor, due to stress levels, and due to our exposure to so many pollutants and so many, hormones disruptors. The quality of embryos doesn't have all the normalities. They are abnormal embryos. Okay, chances of abnormal
you are on mute.
babies.
I think there was a disconnection. I'm unable to hear you.
Okay.
Can you repeat the last 10 seconds, Hello?
Yeah, I'm saying that the reserve in our ovaries, the egg reserve, the quality of the eggs and the number of eggs, both reduce, both decline with the age because of our stress level, because of our, exposure to the pollutants and your hormone disruptors, our eating style, our lifestyle, everything.
Okay.
So, yeah. And in male case also, even their sperm count also decreases, sperm volume decreases, their morphology and their motility, and again, the DNA is changed. There is some abnormality in that. So it is better to start, if you are planning to have a family, it is better we should plan ahead.
Got it. And for people who are in their 35s and late 40s, or sorry, early 40s, the major marker is to clean up the food. From whatever we discussed, what I understood is, please correct me if I'm wrong, clean up the food majorly, clean up the environment, endocrine disruptors, and then probably take a proper nutrition advice and then get from there. And the earlier the better in terms of conceiving. Am I right?
Yeah, definitely.
Okay.
Yeah.
Okay. And can you summarize from your experience and from your knowledge, what will be some of the lessons learned from your own experience and from your client's experience and whatever your professional experience?
Yeah, I definitely want to share my lessons of my 17 years of infertility. Number one lesson is that IVF is not 100% or even more than 50%. Its success rate is only 30%. And that too also decline with the age. Okay, so don't expect that you can have your baby anytime when you want to, in any age you want to. Okay, another thing is, sometimes I don't know whether this will be relevant here, but I think if IVF, we are going for IVF, what I thought, what my family said, that you take bed rest and don't move from your bed and your chances of conception will increase. But that was not the case. When I got up after 15 days, all my legs muscles were, I was trembling like this. So after my 5 IVF attempts, I came to, this conclusion that you have to keep walking. Bed rest doesn't increase your chances of fertility, whether you are conceiving normally or whether you are conceiving with IVF or IUI. Okay, if you will keep moving, your movement is in your lifestyle, that will definitely help you. Another thing is stress plays a huge role. We all are ambitious people. We want to achieve something in life. Okay, being a woman, I want to, do a good job. And when there's kind of stress, taking leave from office every day, and then going for a test, and then going for treatments, and asking for holidays again and again. But now it's good that we can work from home, but still there is a pressure. So you will have to find out a protocol where you can increase, either meditation or through yoga or breathing practices, so that your cortisol is down. Okay. The more the cortisol, your chances of conception are lower, and you are increasing inflammation in your body. Okay. And another thing is that you have to take care of the deficiencies. If you feel that you are eating good and everything will be taken care with the food only, gone are the days. Okay. If in our earth only there is, lack of minerals and lack of nutrients, so how can you expect that a tree grown on that earth will deliver you the fruit, will deliver you, or the veggie will deliver you the right nutrients? Okay. Earlier there was an apprehension that I cannot take pills or in form of supplements, but now people are getting open. But it is a clear-cut message we give to people in our consultation also, that vitamin D deficiency is huge in case of fertility. Okay, you will have to level up your vitamin D. Omega-3 is a fertility, fatty acid. Increase your omega-3. And then CoQ10 is huge for fertility. So these are nutrients. And even protein thing, if you are vegetarian, if you are not getting adequate amount from your diet, you will need to replenish it. And few deficiencies will increase your work. Okay, so complete the deficiencies and you will see the results.
Okay.
Yeah. And another takeaway is that smell the roses on the way. Whenever we are expecting, I waited for 17 years. I cannot postpone small little, life or landmarks in my life, that I will enjoy life after having baby. Okay, life doesn't happen that way. You will have to relax, take a deep breath. Okay, everything will happen on its own time. Take care of your health, because anyway, if you are naturally conceiving or you are going for any ART, your body should be ready. That should be strong. And start, go for a good holiday. Start enjoying life. Don't postpone things that when will I conceive, only then I will be happy. Yeah.
That also relates to and reduces the stress levels when that is, I believe I think that's what your point is, right? So smelling the roses along the way.
And one super tip, because we are living in a joint family, and in our Indian culture, our in-laws are always pressurizing on us that when will you start your family? When will you start your family? So this super tip no one will give you, that keep them saying that I'm going under treatment. Whenever my mother-in-law used to call me, that okay, or all is well, how's your job doing? Okay, mama, this time I cannot come to you. Why? Because I am undergoing I have an appointment with doctor. When she listened, whether I was not having, but I used to say this, that I'm having an appointment with doctor, and she becomes relaxed. Okay, my kids are not, taking this lightly, and they are meeting doctors and they are undergoing treatments. So keep them saying that, yes, I am undergoing a treatment, I am meeting a doctor, so they are relaxed. Okay.
Got it. Thanks for that particular tip. I think that feeds very well into the psychology of handling the stress as well. I get that point. Thanks for that.
Yeah.
And one question you were mentioning about the endocrine disruptors. There is not much awareness in mostly whenever there is a talk about endocrine disruptors in this modern world. Can you please shed some light about that? So that people can relate to, okay, I need to watch out for these things as a starting point.
Yeah. First of all, in our household, the cleaning things which we use for our cleaning utensils or our clothes, that have all endocrine disruptors, that cleaning detergents. Okay, the creams which we use on face, are they paraben free? Okay.
So, will you be covering a little bit on the whatever you said right now is the environmental endocrine disruptors? Is there some
Household.
household?
And
Are there any endocrine disruptors in food as well? If you could shed some light on it, whether
yeah, if we are using, you can say, if you are not using organic, maybe dairy, if you are not using any organic, or eggs also, they have little bit of hormonal, you can say, if they are not organic, because some injections are, some pesticides are on our pulses also, in our grains also, so they disrupt.
okay.
Yeah.
Sometimes sometimes people have, it is very micro amount. It is a fertilizer is used. It is not going to
Definitely,
this,
fertilizer,
but
DDT in the, yes, definitely. So ideally, organic, we should go for organic. If not, then we should definitely watch that from where are we taking all our, food items. We have to be watchful. And some stored things, like canned things. For example, are we using raw or original from the source, or are we using stored things?
okay.
Preservatives are added in that. So we have to take care of that also.
And coming to the liquid, you were starting to say about the liquid external items such as the detergents.
Yeah,
Right.
household items. There are many sprays, mosquito sprays we are using nowadays. We are using deodorants, and we are using so many creams.
So those are also endocrine disruptors, is it?
Yeah, those are endocrine disruptors. We suggest in our soon to be mom program to limit those things or shift to natural things.
Okay.
Yeah.
Fine. Thanks so much for all this information, and it really serves as a good starting point for people who are looking forward to conceiving and then thinking about correcting their food. I would like to open the floor for questions, and we will address some questions. And before we open the floor, Meenakshi, is there anything which you wish to share apart from whatever we discussed or whatever I missed?
Yeah, I think I shared most of the things. If something comes in my mind, I'll share, definitely.
Okay.
We have 2 minutes left. Yeah.
Fine. So we'll open the floor for questions, if any.
Yeah, sure.
Is there?
Meenakshi, are you hearing me? Yeah,
Yeah.
This is Arun.
Yes,
Actually,
sir.
the case you were showing here, the case study, I have just observed the first test report shows that estrogen level is quite high.
Yeah.
Correct. So,
Yeah.
do you think that due to the estrogen dominancy in that lady,
Yeah.
there is a delay in pregnancy, or she was not able to conceive? Have you taken this parameter? PCOS, of course, I have noticed that there is a PCOS, but estrogen dominance is also the cause of that.
Yeah, yes, definitely, Arunji. Estrogen dominance is definitely the reason. And she was having pain during periods, and she was having very much blood flow during her cycle also. So estrogen dominance is huge in case of fertility. We have to take care of that. I started giving her, she was constipated also. So I started giving her some, cruciferous vegetables and fiber intake. I increased so that her constipation problem is solved, and that estrogen, balance come
maintain.
in. Yeah.
I mean progesterone and estrogen balance maintain.
Yeah.
But Then after did not test because she got conceived.
Yeah, she got
That's
conceived.
then
Yeah.
no meaning of checking the estrogen level. Of course,
Yeah.
I understand that.
Yeah.
That's a very nice. Actually, this is very new things we are learning because I have seen some of the cases, but I just referred to some of the other person for this
Okay.
infertility. But this is something very new. I understand because estrogen dominancy was I was reading just few days back, and relation to the progesterone. So normally, what doctors do, they put progesterone replacement therapy, giving some extra progesterone one way of the
Yeah.
hormone.
Yeah.
So you have given something different, and you have given vitamin D. You have given some food, a low carb diet, reducing the insulin resistance and all. So
Yeah.
these all take care of this estrogen dominancy and rising of the progesterone. Actually,
Yeah.
I wish I could have seen the next test report where the level of estrogen and level of progesterone. So, but
Sure, definitely.
of course, I can guess that when she conceived, that means estrogen reduced and progesterone increased. So balance
Yeah.
is maintained there. Okay, Meenakshi, very
Thank
thank
you.
you.
Thank
It's
you,
a
sir.
very, very, very nice what you have elaborated the case. Really, I'm very thankful to you. Thank you very much.
Thank you. Thank you, sir, for giving me
Thank you.
opportunity. Thank you.
Okay, so next.
All
Prasanna.
questions answered.
Just a minute. Let me check the chat box if there is.
Chat box is empty. Good. No question, Meenakshi.
Thank you.
For usually, okay, then how important is blood sugar management and testing? The question is from Sanjeev Givala in the chat. How important is blood sugar management and testing for fertility in the context of fertility? That is the question.
Yeah, definitely it is very important because some people have, some female have gestational diabetes also, and people, doctors do consider that because as you know that insulin is a growth hormone. So the size of the baby increases in the uterus, and it becomes very difficult for the mother as well as for the baby. So we keep a check, or moreover, it increases inflammation in the body if our sugar is not up to the mark. So this is very important.
Okay.
But this low carb diet helps in that. It will take care of that sugar thing also, along with some nutrition.
Okay.
And
so
lifestyle change, yeah.
Understood. So blood sugar management is very much important, and that's what you said. And the key is in adopting a low carb lifestyle, wherein the insulin is also taken care. That is, the insulin regulation is taken care.
Sometimes we have a notion in our mind that I'm going to deliver a baby, so I have to eat a lot. I have to eat so many times, and that too, the traditional so-called healthy food in form of grains or in form of sugary fruits and all. Sometimes we feel that is healthy and we should consume that. But that is not the case. I told you with the example of egg, the most important thing for baby is protein and good fat. And of course, we do keep carbohydrates as well, but there is a limit on that.
Yes, that is going to be my next question. Actually, many Indian mothers feel that once the pregnancy happens or at the time of pregnancy, we need to do a little bit of carbohydrates, which is not rationed. which is not rationed or controlled, it needs to be there. It is an essential component because there is another person growing it. So that is the context. So in that context, I understand that I need your input on, is it something for the pregnancy to happen, and even after the pregnancy also, how practical it is and how important it is to follow a low carb lifestyle?
See,
is it relevant?
Yeah, it is relevant. Definitely. I just asked all my clients to continue with this diet only. With the low carb diet, she can, do some kind of fluctuation if she is not diabetic, or if she has not any metabolic syndrome or metabolic disorders. She can take little bit of liberty, but I always say to her that this diet is completely healthy. Increase intake of nuts and seeds. Okay, healthy doesn't mean carbohydrates only. Healthy doesn't mean only fruits. Okay, I guide her throughout her journey that healthy, the definition of healthy is changed now. Okay, so this is completely safe to adopt low carb throughout her pregnancy. There is no complication. Even her complication is reduced.
Okay.
Her her chances of having gestational diabetes is reduced. Okay, and she get very healthy delivery and healthy baby.
Okay, thanks.
And actually, I just wanted to add one more thing here. Earlier, somebody was asking about the high insulin level, or in case of the when diabetes is, when person has conceived, the lady has conceived, she is having normally high insulin level. That must have to be checked. Otherwise, preeclampsia and gestational diabetes are two complications bound to come, and which will causing a lot of problem during the delivery. So
yes, definitely.
So
yes.
many of cases these are actually controlled post delivery, but it is not necessary. Once gestational diabetes is there, there is a full chance that lady will develop full type 2 diabetes after the delivery. Am I correct,
Yes.
Meenakshi?
True. I agree with you, sir. Yeah.
So controlling the insulin level during the pregnancy or before pregnancy is very essential. Okay,
yes,
thank you.
Yes.
Thank you.
Yeah. Thank you. Thank you for adding. Yeah.
Thank you. Fine. Let me check quickly if there are other questions. Okay, I believe right now there are no questions. So I'd like to thank Meenakshi for taking the time to dispel some of the myths as well in the form of lessons learned, and in the area of fertility and then the low carb nutrition. And I believe this is going to be really of value to all the listeners. Thank you so much for your time and all the information that you have provided. Thanks each and every one of you for joining and making this session a success.
Thank you. Thank you so much. Thank you, D-Life, for having me here and sharing my story and reaching to so many people. And thank you, Prasanna. You are excellent host, and you are quite patient, and you ask very relevant questions. Thank you so much.
No problem. Thank you. You're welcome.
Thank you.
So